The VR therapy design I will be focusing on during this presentation will be acrophobia, the fear of heights. Acrophobia has been previously studied in various virtual reality exposure therapy studies in the past. A few professors at a university in Germany studied the effectiveness of VR therapy in tackling acrophobia by comparing how patients with acrophobia reacted to a height simulation in VR versus how patients without acrophobia reacted. The VR simulation was proven effective for those who experienced fear of heights due to decreased ratings of the fear response. My design treatment will also aim at decreasing the fear response in patients with acrophobia during a heights-based VR simulation. It will hopefully also serve as a stepping stone for patients who would wish to continue treatment in an in vivo setting. In this design, there will be two groups of patients, a control group and an experimental group. The experimental group will be exposed to a 10-week session VR treatment. Each treatment session will last a total of 50 minutes. This would ideally consist of 10-minute exposure sessions at escalating levels of intensity. This method is pulled from another study, which I showcased in my last presentation, where the researchers slowly added to the treatment simulation in order to eliminate the possibility of overwhelming the patients too soon. The lowest simulation of my design would consist of the patient standing on a street near a tall building. This level of a simulation would test whether patients experience anxiety simply by being near a situation that might cause their acrophobia to kick in. The second level consists of being on a ledge of a building a little bit higher up than the first level of exposure. The subsequent levels 3 and 4 would place the patient higher on the building until level 5, which would have the patient on the top of the building looking out over the edge towards the ground. During the time in the simulation, patients would report a SUD score every minute in order to rate their anxieties during each part of the simulation. SUD stands for Subjective Units of Distress and helps measure people's anxieties and fear. This unit of measure has been used often in other research designs, including VR treatment designs. Ideally, this VR simulation would slowly start to lower the SUD scores as the patients adjusted to each new level. Once SUD scores have decreased to a sustainable level, patients will be able to move on to the next level until they have reached the final simulation. By this point, hopefully the patients will have shown a significant decrease in fear due to heights.